Actually, there's been a lot of trials that have tested yoga alone as a blood pressure treatment. Yoga can bring down your systolic blood pressure by about 7 or 8 and your diastolic blood pressure by about 4 or 5.
And the way to lose that best to treat your blood pressure is not through starving yourself with diet, but through exercise, which of course yoga is, but there are more intense cardiovascular exercises that will reduce your blood pressure in 2 ways. The first is it will reduce your weight. The second is just the... Indian food is amazing. We've already talked about this, but it is not low in salt. The sabjis and the curries and things like that are being replaced by these like Maggi instant noodles, which are even saltier. They are going to increase your blood pressure significantly.
South Asian salt intake is almost double what it should be. The WHO recommends about 5 grams of salt a day, and South Asian diets are between 9 and 12 grams.
What?
Welcome to Delhi Belly, a series of conversations around preventative health tailored for people of South Asian origin. And today we're going to pick up on that conversation we were having about hypertension. So we've got our 35-year-old gentleman. He's measured his blood pressure a couple of times on his home machine, and it keeps coming back at around 145 over 90. So the big number, 145, the small number, 90. He goes to his doctor and says, "What should I do?" And the doctor says, "We probably need to start you on a tablet." He goes and rings up his dad in India, who says, "Actually, there are non-medical ways to manage this. Have you tried yoga?" He's not sure. Should he go on tablets? Should he not go on tablets? What would your advice to this gentleman be now?
What a great question. Well, I don't think yoga's such a crazy idea. Maybe we'll talk about that later on. I can see why his physician wants him to take tablets, because doctors give people tablets, right? It's how we cure problems. I'd want to know a little bit more about him and his lifestyle. And perhaps we'll talk about that over the coming podcast. And then you might be looking at the sort of type of high blood pressure that he's got. Like he's got high systolic and diastolics. People have got high diastolics with low systolics and things like that. But primarily I'd be looking at the systolic number, the big number, and to bring that down. And he's back in America now, or he's seeing his doctor in India?
Yeah,
right?
He's back in America.
So if he's back in America, his doctors are going to be targeting a blood pressure of 120 over 80, which is what I would target also in the UK. And I don't see why we wouldn't do that in India either. That's got the best benefit, right? We're going to talk about the degree to which he will benefit over the course of time if he gets his blood pressure that low. So we alluded to this last episode, but essentially every 10 millimeters of mercury that you drop your blood pressure, you reduce your risk of heart attack or stroke by 20% over a long period of time. So he's going to go from 140 to 120 if we get it right. It's a 40% reduction in his risk of stroke over the course of his life.
Yeah, really significant reductions. And this has come about from studies of 600,000 patients from 100 different trials across the world, all brought together. We know, as you said, big reductions in stroke, big reductions in heart attacks, and a 13% reduction in mortality.
Wow.
By a 10 millimeter drop in your blood pressure, which means regardless of how you get there, and we'll talk about that, but if you can bring that blood pressure down by 10, you reduce your mortality by 13%. That is a big, big jump.
Yeah. I mean, let's be honest. You're not reducing your total mortality. In the end, mortality happens to everyone. But over a period of time, say a decade, there are 13% more people alive if they control their blood pressure than if they don't. So if you want to buy a ticket to that lottery, that's a good one to buy, right? It's nice to know that you're doing the absolute best to prolong your life expectancy.
Yeah. So let's talk about the different ways people can do that. And I guess you've got medical, which is tablet options, and non-tablet options. So let's dig into the tablet options first, because that's where we've got a lot of data, a lot of science on, because they've been used for decades. We know there are a lot of different agents out there that are effective at bringing blood pressure down. Now, I was looking through the Indian guidelines and the British guidelines, and one big difference that I saw was that in the Indian guidelines, they recommend that if you've got a gentleman like this whose systolic blood pressure is above 140, you go straight in with a multi-drug option, which means you don't just start one tablet, you start a combination pill with 2 different drugs in it at once.
Yeah.
And I thought that was really interesting, because in the UK, we're taught to gradually build up, assess, reassess, keep building up from a position.
Yeah.
Whereas in the Indian guidelines, they're saying go straight in with 2.
So what might happen if you go see your GP with high blood pressure in England is that you might get one drug, and then they'll see if that works over the course of a few weeks. And then if they're not quite at the target, you'd take another drug on top of that, or increase the dose. And it sounds like the Indian guidelines are a little bit ahead of the British or the NHS guidelines at the moment for reasons we can speculate about. But across the world now, there's a sense that if you have blood pressure that you really want to control, you usually get better effect by adding small doses of medications of different classes together than big doses of one medication. And the reason for that, we kind of explained in the previous podcast, right? There are lots of different systems acting in the body to keep the blood pressure up or to keep it maintained. And so targeting just one of them means the other one can just increase the blood pressure itself by the side. But if you kind of reduce one or two or three of those areas or systems that are trying to increase the blood pressure a little bit, you can get really good effects with small doses of both. I think the second reason why we might be seeing that in the Indian guidelines and not in the British guidelines is that in India, it's easier to get hold of combination tablets. I've seen lots of them. People often come to see me and they've been treated for hypertension in India and they're on these combination tablets that we don't have available to us. A bit of that is because it's expensive to combine the tablets together. And so the UK system uses like the lowest common denominator drug that it can. And it's probably more expensive to combine the drugs than it is to actually make the drugs. So we use kind of cheap combinations. But the idea is in the end, you would probably end up with more than one class of drug here as well.
Yeah, and I guess each guideline is tailored to the health system it runs in. So as I said earlier, that 1 in 3 Indians don't know they have hypertension, even though they've got it. And so that means when you walk into a doctor's clinic for your back pain, your kidney pain, your leg pain, and you get your blood pressure checked and you get found to have hypertension, often your first reading is a higher one. And so we're already in the territory where you need a good level of reduction to bring your risk down. So it makes sense that in those sort of situations, you go in with multiple agents, as you said, because you can attack different systems that are driving up that blood pressure. Whereas in the UK, I guess in an ideal world, you've been regularly engaging with your GP over a number of years, over decades, and it's gradually creeping up. And then you gradually introduce those medicines to bring it down. So it may not all be a biological, it may be a health systems rationale as
Possibly,
well.
yeah. And so there are a group of combinations. You might get a blood pressure that relaxes the blood vessels in your body. And that's often very effective in Indians, actually. You might get a medication that reduces the amount of salt that your kidneys get hold of.
Got it.
And so that can reduce your blood pressure through passing more salt into the urine. And then there are other blood pressure medications that affect the nervous systems that we were talking about that keep the blood pressure up or can reduce it. Finding those in combination are really useful. And then if you've got specific other problems, you might get specific other blood pressure medications. So for example, if your kidneys are already damaged a little bit by blood pressure, then there's a specific category of blood pressure medications called ACE inhibitors, ACE inhibitors, which can protect the kidney as well as reducing the blood pressure. Likewise, if the pump function of the heart has been reduced a little bit by blood pressure, those drugs work really well. Whereas if you don't have those problems, you might find it more effective to take a different combination of tablets. And that's something for a doctor really to think about with you and individualize. It's impossible to give this 32-year-old guy who with apparently no illnesses like specific advice just without having a bit more information about him.
Yeah, and the reality is that you can spend a lot of time trying to guess almost what the physiology is in that person, what's driving their blood pressure. But ultimately, you need to bring that blood pressure down. We know that number needs to come down to bring that risk down. So try something. If it works, fantastic. Keep going until you've got a significant reduction or you come back to normal. Or if it's not working or you're having side effects, try another. So there's almost a little bit of a pragmatic approach to bringing it down as well. Yeah,
there's some fascinating studies that are happening right now about being a little bit less pragmatic and a bit more personalized, where people are measuring blood levels of very specific chemicals that will tell you which of those different systems are more active in you than others at a pretty broad scale, linking it sometimes to your genetics. So you might be able to have your genetic status tested to see which best fits you for blood pressure medication. I'm really excited about the results of some of those trials, but they're not available at the moment. And so people do use a trial and error approach or a stepwise approach, drugs with low side effect profiles, drugs without obvious problems for that individual. So, if you've got a problem with your nervous system, don't take a nervous system drug, for example. And in the end, you arrive at a nice combination of medications, but you've got to get the number down. So if you don't do it, that risk of future heart attack, stroke, all that stuff just stays. And you won't know anything about it. You won't have the symptoms. You won't feel unwell until something really bad happens. And then you wish you would have treated it.
Sure. And you can do both. You can do medical approaches with tablets and you can do lifestyle changes. And there is actually some good evidence for lifestyle changes. So this gentleman's dad who recommended yoga, actually there's been a lot of trials that have tested yoga alone as a blood pressure treatment. And interestingly, I read a meta-analysis of 30 trials. And for the first time in all of my reading, in this combination of 30 trials, the majority came from India. 17 of the trials out of the 30.
That's so cool.
Yeah, came from India where they were testing yoga as a treatment for blood pressure. And they found that yoga can bring down your systolic blood pressure by about 7 or 8. and your diastolic blood pressure by about 4 or 5. So for this gentleman with a systolic blood pressure of 145, he could be looking at a reduction to 137, 100, something like that. And again, each person is different. One example of the sort of regimen that was tested in one of those studies was doing yoga up to 5 times a week and then maintaining that over a 3-month period to see that sort of benefit. So if this gentleman is going to be going down the yoga path, it can't just be a 1 session a month protocol and trying to see that benefit. It's got to be a regular, intense protocol of yoga.
Okay, well, I was big into yoga at the beginning of this podcast. I'm a little bit less certain now. 7 mmHg of mercury is the reduction from an intense yoga session.
Average.
That's about half what you would expect from a single medication, right? So there's a bunch of other stuff that a yogi could do to reduce their blood pressure if that's what they decided to do from a lifestyle perspective. Okay, and let's talk about the first things. Yeah. The first thing I'd want to know is what that person's weight is. I'm not going to talk about BMI, I'm just talking about their weight, right? If they feel a little bit overweight, if they're carrying a little bit of extra fat around every day, they've got to lose that.
Yeah.
And the way to lose that best to treat your blood pressure is not through starving yourself with diet, but through exercise, which of course yoga is, but there are more intense cardiovascular exercises that will reduce your blood pressure in 2 ways. The first is it will reduce your weight. The second is just the cardiovascular system exercising means that when it's at a relaxed state, it does a better job at relaxing. So it just brings down that blood pressure. Just having done the exercise, your resting blood pressure will be lower. So that's weight loss plus exercise. The other thing that weight loss can do, in some people, there's a condition called obstructive sleep apnea, particularly for big overweight guys and for people who snore a lot at night. Sometimes they might find that they've got this condition called obstructive sleep apnea. It's very detailed, you should look it up, but it essentially stops you from breathing properly at night when you're asleep. And that can make your blood pressure go up a lot. And weight loss really helps with obstructive sleep apnea, can improve your blood pressure as well. So those are 2 things that exercise, weight loss and would help with. Then I'd be really interested to know how much salt is in that person's diet. Indian food is amazing. We've already talked about this, but it is not low in salt. And what I've seen in my trips back to India is that the traditional kind of salty foods that we used to eat, like the sabjis and the curries and things like that, are being replaced by these like Maggi instant noodles, which are even saltier. They are going to increase your blood pressure significantly. And take a look at the salt content of what you eat. You had an interesting statistic about achar, right?
Yeah, I was wondering where all this salt comes from in the Indian diet. Yes, you said processed foods is a big problem, but actually on dietary surveys, it's not just the odd noodle here or there. South Asian salt intake is almost double what it should be. The WHO recommends about 5 grams of salt a day, and South Asian diets are between 9 and 12 grams. Okay, so that's a lot of salt coming in.
So Indians eat double the amount of salt that the World Health Organization recommends.
And so where's that coming from? I found that a tablespoon of achar, which often just goes as a side thought alongside the main meal for Indian people, sometimes even at breakfast, contains your whole salt allowance for the day.
What?
1 tablespoon of something that people passively take in is their whole salt intake for the day. So if you are one of these people with high blood pressure who are thinking about how can I bring my salt down, perhaps removing 1 tablespoon of food from your whole diet.
But it tastes so good.
Well, this is the trade-off people need to think about making. Healthy living is not always easy. And so you've got to think, what are the sacrifices you're willing to make?
So, I mean, medications are always there and we could talk about those. Really, that's a conversation with your doctor. But the lifestyle things you can do to improve your blood pressure are exercise, think about your salt intake, lose some weight. Maybe yoga on its own has some effect, but I really want to see that in a package of intensive kind of improvements, especially if you're worried about your health.
I mean, these things that you said, yoga, exercise, salt reduction, weight loss, give you about a 5 to 7 millimeters of mercury reduction in your blood pressure. And the blood pressure medications we've spoken about, we're looking at between 10 and 15 if you're taking one agent, but that multi-drug combination that a lot of Indians are started on, perhaps 20 millimeters of mercury reduction. And so you've got to also be sensible in terms of what your blood pressure is. If you are on that stage 1 level where your blood pressure is around 130 systolic, you could probably get yourself normal if you're really intensively committed to diet, exercise, and lifestyle changes and weight loss.
Yep.
Whereas if your blood pressure, like this gentleman, is 145 systolic to begin with, maybe you need both.
Probably need to go onto some medication and do the lifestyle changes. And that's what a lot of guidelines suggest, right? When you start to get up in those numbers, 140, 150, you can't really negotiate your way out of requiring medications in the long run, even with excellent lifestyle. But I have seen people do it. It's been quite extreme and it's always been a surprise. And it's really fun to see when it happens. But a lot of the time, the medications are going to help you along the way. I suppose as you lose the weight, and if that's what you're going to do, and you do the exercise, the doses of medications that you require could also reduce. So doing that in combination is often quite a good thing to do.
Fine. And so on the end of this 2-part series on hypertension, if I can give some headlines of really recommendations that people should think about. First of all, know that high blood pressure is common, and it is a common, if not the most common cause of heart attacks and strokes. It is also treatable. And we know that for every 10 millimeters of mercury, or every 10 of that big number you can bring down, you are really dropping your risk of heart attacks, strokes, and improving your survival just by bringing that number down.
Yep.
And we know that most people who do have high blood pressure don't have it treated well. And we know that you've got lifestyle changes, you've got diet, you've got exercise, weight loss, but also very effective medications that can really bring your blood pressure down.
Great.
We'll leave it there.
Thanks a lot.